So we're going to treat two muscle groups next. They all kind of work together. We've got the hip flexors, or the iliopsoas, or the iliacus plus the psoas muscle, which connect from the inside part of the pelvic bone here and blends together with the psoas muscle that connects here to the spine to around this area in the hip. These muscles are very important for helping to bring the leg up, like if you're a sprinter, getting out of the blocks and having that high knee drive. If you're a long distance runner and you're having a hard time like lifting your legs up higher when you're running and it feels like you're kind of running through mud, this can be a very common problem muscle that you need to work on. Sometimes you just need to strengthen up your hip muscles too, the butt muscles especially, the gluteus maximus, and sometimes this will start to shut down. But with that said, those two muscles are very important for good function of the hip, the spine, and sometimes the knee. And then what we're also going to be treating right now, because we're going to essentially be in the same position, is the rectus abdominis. Now, the rectus abdominis sits kind of up here or connects to the cartilage on the bottom part of the ribs, and it connects all the way down. This is a six-pack muscle, mind you, to around here on the pubic bone. So it's a very long muscle. And what we're going to do is we're going to just kind of position ourselves on our stomach second to treat the rectus abdominis. But what we're going to be doing first is positioning ourselves on our stomach over a ball. And basically what we want to do with the ball is get it to rest kind of in here, kind of get it to sink into that rim of this muscle onto the iliacus muscle. Since you have two hip flexors and usually both of them are dysfunctional if one is, but not always, you could, if you wanted to, use two lacrosse balls at the same time or two balls at the same time, where you put one on each side. I find that usually works fairly well. So what I'm going to do is I'm going to get most of the way to my stomach. I'm going to find that hip bone. I'm going to put this just on the inside of that, and I'm just going to lay down. Now, if you prop yourself up on your elbows, you'll feel a different sort of pressure than if you're flat. If you can tolerate this semi-comfortably and keep relaxed, and your back can tolerate this as well, then I would recommend this kind of prone on elbows position for treating the iliacus muscle. Now, because it's a little bit hard to massage this, all you would have to do after you're done is basically do like a few little circles here to do the massage after you hold 30 seconds of pressure once or twice. After you're done with treating that area, it's onto that six-pack, again, from the bottom part of the ribs to the kind of pubic bone area. So, again, you could use two of these balls at the same time if you wanted to treat both sides at the same time. You're going to lie on your stomach, make sure this is beneath the ribs, and you're just going to kind of roll yourself back and forth a little bit, up and down until you find a tender spot. You're going to just make sure your stomach is relaxed. And once you find a tender spot, like I already found, you're going to relax onto it for about 30 seconds. After 30 seconds, you're going to move yourself up, find another one, apply pressure there for 30 seconds, and make sure you do this to both sides, to at least search for trigger points on both sides. After you're done, you can either use this or a foam roller. I think the ball tends to work best on your stomach, and you're just going to roll yourself up and down to relax those muscles even more and help increase the blood supply there to flush out some of those biochemical markers that you're trying to get out of the area. First off, I'm going to start on the side of the hip, the gluteus minimus and medius muscles. You can use a foam roller or a ball. Put this on the outside of your pelvis, roll yourself up and down. Notice that the foam roller right now is perpendicular to how my body is long. But we're going to use our body to roll up and down, find a tender spot. If we found one here, we're going to hold pressure there for about 30 seconds. And just like when we were doing it on the thigh before, don't forget to try rolling forward or rolling back when you're searching for tender spots, because if you roll back or roll forward, you may find some that you would have missed if you just were staying straight on your side. After you treat all the tender spots for 30 seconds each of sustained pressure, then you're just going to roll yourself up and down for about a minute or two, making sure you roll back a little bit, making sure you roll forward a little bit to treat the whole area that you just treated with the sustained pressure. Now, after you're done doing that, what I would recommend to get the gluteus maximus is you're going to kind of sit on it like this, and you can basically roll yourself up and down with it, again, being perpendicular to the length of your body, and somewhere between the sitting bone on the bottom of your butt and the top part of your pelvis, you'll probably find a few tender spots as well. Again, you'll want to apply 30 seconds of pressure to all of these that you find, and then after you're done, use your arms and or opposite leg so you can keep the leg that you're treating relaxed. Use those limbs to basically pull yourself up and down to massage that area. After you're done with this, there's one last part. Now we're going to flip it. Now the foam roller is going to be in line with our body. And we're going to roll forward and backward, keeping the buttock relaxed that you're treating. And this is going to allow us to either get to deeper fibers of these muscles or possibly down to the fibers of the hip external rotators. But once you find a tender spot here, hold again for 30 seconds, treat all the tender spots that you can find, and then finish it off with a massage by rolling your body back and forth. That's all you have to do for this area. Hopefully your IT band should be looser afterwards. You may have less back pain. You may have less knee and or hip pain as well. The last part of this video, I'll be talking about the low back, specifically the quadratus lumborum. I find this is a very nasty muscle that a lot of people have tightness in, that it responds very, very well to this type of treatment. And if you package it with some of the other treatments that I showed you, it works usually the best. Usually this muscle's not tight in isolation. So the quadratus lumborum, kind of a big name here, lives on the ribs, the kind of bottom two ribs, and it connects to these bones on the outside part of the spine called the transverse processes. And then it connects to the top part of the pelvis right here. Now, if this muscle goes into a spasm and gets tight, it's going to basically crimp all of this stuff. It can give you rib pain down here. It can give you problems in the low back. It can give you SI joint pain, and because it can crimp on this area, it can also give you hip pain. So this is a very common muscle. I usually recommend people at least kind of apply some pressure here to kind of see if you can find tenderness and see what happens, see if you can get a relief or release of anything in this area. You unfortunately won't be able to see much when I'm doing this video, but what I'm going to be doing is treating this first with a lacrosse ball, and then I'm going to be treating it with my Theracane. So with that said, how you're going to do this is you will lie on your back with your knees bent. You're going to take the ball, you're going to put it on the back side of your body. You're going to roll back and forth on it, side to side a little bit. Now remember, you don't want to be on the spine. You want to be to the side of the spine. And you don't want to be on the ribs. You want to be below the ribs with your ball. And you're looking for a tender spot. Now, usually in this position with your knees bent, you're not going to be able to feel like you're putting enough pressure on it to do much good. So what you can do is, it's on my right side right now. I'm going to take my right leg and put my right ankle on my left knee. And basically this will put more pressure on it. Or what you can do is pull your knee towards your chest, relax your other leg down, keep this leg relaxed, and hold this for about 30 seconds to release that tender spot on that muscle. And again, you want to treat all the spots in this muscle that you can find that are tender. Now, for whatever reason, if you find that you can't put enough pressure on it with the ball, you can use a foam roller on it as well. Same principles, you want to stay below the ribs. Or you can use a Theracane, which I find actually probably works the best. So with the Theracane, now usually they have a more pointy end, if you can see that on this video, and they have another end that's a little bit more round. With the round end or the pointy end, they both work equally well in this, just kind of depending upon your sensitivity. So I'm going to get into the same position again. I'm going to put the curved end of this into my back, and I can basically angle the cane to help me search out those spots. Oh, right there, I found one. And I'm just going to relax onto it. Again, you have to relax the muscle that you're trying to treat. If you need a pillow for this, feel free to use one for your head. After you apply 30 seconds of pressure, obviously it's going to be a little bit hard to do a massage with a Theracane. Technically, you could kind of roll it back and forth like this. I think a foam roller typically works best for this, to do the self-massage. You could do a self-massage with the ball. If you're going to do the self-massage with the foam roller, it should essentially look like this. You're rolled a little bit off to the side, you're staying below the ribs, and you're just going up and down. Again, whatever massage technique you use, whether you use the Theracane, the ball, or the foam roller, do it for about 30 seconds at least, but up to 2 minutes.